Dr. Janice Johnston's with us. I'm sorry, Dr. Johnston, I thought we were going somewhere else, but now we've got you, and I'm looking forward to talking to you about this. All right, we've been talking about this in terms of people are recovering after a week or maybe 2 weeks, but now we're seeing some long-term impacts. Tell us about some of the things that you have seen.
So in terms of the general population, the adult population, most people will feel well within about 7 days or so. They may have some lingering minor feelings for a while. Fatigue is probably one of the main things, and maybe a mild cough. Some muscle aches and things like that. But the general significant symptoms that they're having have generally cleared within about 7 days, and we're releasing now out of quarantine at the 10-day mark. For children, thankfully, we do know that patients of any age can get COVID. Thankfully, children, if they do get COVID, seem to have a very, very mild course and generally have like a cold-like symptoms with it. There have been increasing reports, however, of something called multi-system inflammatory syndrome, which is something that we have been aware of for some time. But it does seem that a lot of these children that are showing signs of this appear to have been infected with COVID-19 or have been exposed to COVID-19.
So obviously there are still things we're learning about this virus as we go. And, probably I would imagine one of the most closely studied viruses in the history of civilization, and we'll continue to learn. So let me ask you this, with all you've seen, and I want to put it in more practical terms because we're coming up on a deadline here in Arizona, and I think a lot of other states and parts of our country and the world really are. Our kids, some of them, are going to be heading back into schools. Give me your overall thoughts on kids heading back into school buildings.
So I think the biggest thing with children is how do we effectively expect them to be able to socially distance, and the younger ones to be able to wear a mask all day long. They touch a lot of things. The classrooms are just not set up to be able to socially distance. My best friend is a first grade teacher, and she's got a lot of concerns about bringing kids back into the classroom. And I honestly don't think that the schools have necessarily figured out how they're going to be able to socially distance kids.
I'm not sure you can, right?
Yeah,
can
yeah.
you? So let me ask you this, and we're coming up on time here. If I don't even know what your background is in terms of family or what, if you had kids elementary school age, what would you do right now in terms of, would you keep them home or would you send them back?
Yeah, so I think that we're not quite ready to send kids back into the classroom quite yet. I think we still have a lot of high numbers in our state right now. So I think the virtual learning, at least for the time being, and to try to pick some sort of metric as to when it is safe.
What do you think about that? And I'm sorry to interrupt you. So, because I keep hearing that we need to find, we need to hit a certain metric. What would the #1 metric be for you to say, oh, we've gotten that, now it's okay to get kids back in school. Now it's okay to have people go back in the office. What is the one thing you're looking at?
I think in terms of the percentage of people that are turning positive, I think is a very important one to be watching.
But don't you have to test everybody? Like, for so long we were saying you can only get tested if you feel like you have it, if you feel like you've been exposed. To really know what the percentage is, wouldn't you have to test a huge swath of our population?
Yeah, you really, really do. And I think testing availability has increased significantly. For children, however, they run into issues. And I hear that all the time when concerned parents are calling Redirect Health looking for testing for their children. And they're just not able to get that either at the drive-through centers, like at the pharmacy chains and things like that. They're not testing children. And I think it is important to offer that to families with children because they are concerned. And
shouldn't everybody get tested? I mean, are we at the point now, and the governor even said this, I think it was a week ago today, if you're just curious, go get a test. And then we opened up those huge surge testing sites in the West Valley, and only a fraction of people who could have gone and gotten those up to 60,000 tests got them. I think it was like 14 or 15,000 out of 60,000 showed up.
Yeah. Yeah, I don't know. I don't necessarily think we need to test the whole population. I think that's a bit overkill for us. But certainly, if you think you've had an exposure and you're not feeling well, and that's the biggest thing with children, is that when kids do go back to school, if they have a cold, just kind of a little bit under the weather, parents really, really, really need to be keeping those children home
Mm.
and not, and I understand they have to go to work and sometimes it's not going to be convenient, but I would really encourage parents that when your children are not well, that you do need to keep them home when the schools are back open again.
Dr. Johnston, great talking with you this morning. Thank you. Hopefully we can have you back sometime. And I think,
Okay,
not going
appreciate it.
to school when you're sick applies to adults too, right? Don't go to work when you're sick. If, I mean, it used to be a badge of honor. Oh, I show up every day. I haven't had a sick day in 5 years, but that's not the way we roll anymore. It shouldn't be, right?
Yeah, and people need to have an income, and I understand that, but we really need to everyone needs to do their best to try to follow the guidelines.
Thank you for all your work on this and your work with your patients and your work in our community. And I appreciate you being on the air. Okay.